Well, here we go. Time for the selfie. Yes, you know the song. No longer will we be finding our patients slip sliding away. Let's talk a little bit about that high-risk patient. That man, that woman. You know you've seen this patient many, many times. Today I'm going to review the protected PCI data. What we have is basically your map, which is compromised during a high-risk PCI. We want to look at the MACE rates from 2 different studies. And then, of course, we want to look at what does it cost to do this. Is the procedure too expensive? We know it's not. And I will take you through 4 or 5 slides, maybe 6, 7. And at the end, we'll realize that this is the appropriate care for that patient that's slip sliding away. Impella, as you know, is the only hemodynamic support system proven safe and effective for elective and urgent high-risk PCI. This has been approved by the FDA. Gives you comfort in knowing that you're doing the right thing for the patient. You might say, was it just the protected PCI Protect 2 study? Well, as you can see here, we have basically 1,600 patients, of which 452 of those are from the Protect PCI study. We have Protect 1, we have our US Impella registry, and we have extensive literature review, totaling 1,600 patients. Let's take a look at what kind of patients were involved in our Protect 2 study to get our approval with the Impella 2.5 in a high-risk PCI patient population. Complex coronary artery disease, that can include multivessel, left main disease. We've seen that quite often, I'm sure. In the combination with a left ventricular ejection fraction of less than 35%. And then if you consider the patients you're looking at and their comorbidities, such patients with heart failure, diabetes, advanced age, peripheral vascular disease, complex lesions. These are your patients, right here, dead center, protected PCI patients. And when you find that patient, I hope you consider Impella 2.5. One example is a case study here of what happens before you will start your Impella 2.5 during a 45-second balloon inflation. As you can see, you have a mean arterial pressure with no Impella on board of 86 millimeters of mercury. After a 45-second inflation, that map's going to drop all the way down to 42. But you might ask, well, what would happen with your Impella 2.5? Let me give you an example. Upon starting that Impella 2.5, you will have a map of 110. But in a 45-second inflation of a balloon, it's only going to drop 12%. As you can see here, 97 millimeters of mercury. That should give you lots of comfort while you're working on that patient and saving a life. The other area that I wanted to show you where Impella supports your mean arterial pressure. We look at this from the US Pella registry, 148 patients. Mean pressure increased by 22% prior to Impella being turned on. Of the 148 patients, we had a mean pressure of 83. After Impella is turned on, mean pressure, blood pressure of 101. That's a 22% increase in mean arterial pressure. MACE rates, of course, we care. MACE during the Protect 2 trial was death, MI, stroke, repeat revascularizations. And you can see compared in the Protect 2 trial to the balloon pump, we had a 29% reduction in MACE out to 90 days. That's significant. That was the primary endpoint being 30 days and revisiting those patients at 90 days. So again, a 29% reduction in Impella versus a balloon pump. To be further noted, if we were looking at a complete revascularization, in other words, treating one vessel versus 2 vessels versus 3 vessels, our MACE rate at 90 days, now this is in both arms of the trial, both the balloon pump and the Impella. We have a reduction from 33, 23, and if you're treating 3 vessels, 17% MACE rate. So it's clear that the more complete we can revascularize, the better results we get when it comes to MACE. One other look at MACE rates. This is just a combination. When we look at 1 vessel versus a combo of 2 and 3 vessels, when treating 2 and 3 vessels at a time at 90 days, we have a 44% reduction. It's clear that not just MACE, not just mean arterial pressure, but do we really truly recover that heart? So what we're looking at here is 4 different trials, not just PROTECT 2. 2 Italian studies. Did that left ventricular ejection fraction improve? I'd say yes, 32%. In the US Impella trial, 17% improvement. P-value, 0.001, statistically significant. PROTECT 1, 31%, and PROTECT 2, 22% increase in left ventricular ejection fraction. So now we're not only helping the mean arterial pressure during the case, we're helping 90-day MACE rates, and we're truly recovering that heart. As you know, our principles of recovering hearts and saving lives, patient-focused first. PROTECT 2 clearly is a solution for those high-risk patients. And last but not least, is this product cost-effective? It's definitely cost-effective. In the PROTECT 2 trial, length of stay was reduced by 2 days. You may say 2 days, but that's 22% reduction compared to a balloon pump. That's a lot of savings. And then readmissions. Our 30-day readmission rate's very important right now to you and the hospitals. As you can see here, we had a 52% reduction in the repeat readmissions. Again, that's a statistically significant number. So, in summary, clearly the best choice when working on your high-risk patients, procedure of protected PCI, the best choice is your Impella 2.5 and a phone call to your local Impella rep, Kenny Jones, our team, Libby and John. Any one of us, please give us a call. Thank you very much, and please have a safe day.
He came from my hometown.
Good night.